Alright, so this is our major lap tray. We're going to leave it on the stringer so that way you can kind of, it's a little bit more organized this way. But again, these are sponge sticks. So you can tell just by that ring there. They call these ring forceps also.
Use them in labor and delivery after you get placenta out and they're trying to get tidbits of the placenta.
And then we have our Alice clamps. You can go ahead, go for it.
Okay, Alice clamps, you basically use to, on your outer meniscus, you can retract with them, and if you get in a lipoma or something, basically they'll clap onto it, Bovie, and then they'll hand it off.
So those are Alice, and I'm going to show you, like, they look like a little hand. Oh, Lord. There we go. It doesn't want to focus very good. So, it's like, yeah, there we go. It, like, kind of looks like a little hand. It's like little teeth, but they're not perforating. So, that's how you can tell the difference. So, those are Alice's, and they come in,
short, medium, and large.
Yep. Alright.
It's Babcock's, short and large. This is if you're doing open appendix or open gallbladder. You want to use this instead of an Alice because this won't penetrate and make the patient septic.
So these are usually used with anything lumen. And you can tell, again, the difference is because they don't have that little hand or anything. They just have that
clear bar,
yep.
Smooth.
All right.
Cokers.
And those are our cokers again. Will you show them the teeth?
Absolutely.
There we go. So remember those. Alrighty.
Peons.
These are called peons, Kellys. So these sometimes people kind of confuse them with like GYN instruments, and we'll go through that a different day. But the jaw, so it's like straight instead of those railroad track looking. It's straight down the jaw. So, but you can tell the difference between this and a hemostat because it's much larger.
Right angles. This can be used in vascular AV fistulas whenever you're passing a loop, a red loop, to contract the vein to the left or the right for the graft.
All right, so those are right angles, and again, the jaw, they have their little railroad tracks, but they're at an angle, so those are the difference. Now these are Schnitt tonsils, and Kim will tell you the difference between these and a hemostat.
So these are what you can put a tie passer on. These are non-serrated, basically. You can put this, wrap it around bowel, and it's not going to puncture into it.
And show them like the length of the, like how they're longer.
So here is a hemostat, and here is a tonsil.
You see the difference? So when you're doing the trays up, you just kind of look at the length. One's like kind of short and stubby, and the other one's long, slender.
Like Virginia Slims cigarettes. Alright, these are your hemostats.
Alright, so all those are hemostats, which those are very common. You'll see those all, like, pretty much every case. Are those Carmels?
Yeah, this is your caramels. You got two.
Alright. And what's the difference between those and the Kelly?
So these right here, not only are they a little bit thicker, heavier, the little railroad tracks, they make this little cut through right here. So if they're trying to get a stapler, a 85 GI or anything like that, it's not going to cut their tissue. It's going to allow the maximum allow of tissue before they put an actual stapler to anastomosis tissue together.
Okay.
Before they get married.
Are those Carmels?
Yeah, they're out of order.
Oh, okay.
Yeah.
Alright, yeah. So those are called Carmels.
And then these are your needle drivers.
Yeah. Okay. Those are our needle drivers. And can you say the one's like more fine, right, in this set?
Let's see. So you have these two. You have the small and the medium that are fine. You have the thicker one right here, which you would put like PDS and all this. This one and this one, the fine, you can put it like a 3-0 silk pop off. So whenever you're in anastomosis, like sewing the 2-0 Proline, if you're sewing the little button in before, you shove it up the anal cavity.
Oh.
For you staple.
So that when she's talking about that, she's talking about suture. I didn't think we were gonna go there.
It's true though.
Yeah, it is true. It's very
you
true.
use it for hemorrhoids too.
Yep. So those are the needle drivers. All right.
And we have scissors. We have small and large Mets.
Okay, those are our Mets and Balm again. We call them Mets.
And then you have your heavy curved Mayo.
Okay.
Straight suture scissors.
And those are long.
These are the short straight suture scissor. This is the short Mayo. And your back house tail clamp penetrating.
Okay.
Don't use this on a drape.
Yes, don't use it. All right, let's go over our tissue forceps.
Okay.
All right.
So we have Russians. They come in
So show me those cups.
the wet. Oh,
The
yeah.
cup. So the Russians, they have a cup. Is there like a more technical name? I forgot.
I don't think so.
me
I know
look at
it's
this.
used to basically you can
Yeah. Nope. Russians.
so they use these. Some people don't like to use the Bonnies or the Ferris Smiths, so they like to use this because it's more delicate on the tissue.
Okay.
And then I'm making sure we don't have the small ones here, because sometimes I don't think so.
They come in all different sizes. All of these forceps really do, but in this set there's only one, and I think there's only. Hold on a second. I'll tell you how many are in this set. There's 12. All right, baby. Now what next?
Let's see. So now you have your DeBakey's. You have multiple DeBakey sizes.
So why is that in this set?
In
In the DeBakey, you see how fine the jaw is. It's got the railroad tracks, but it doesn't have the hips. But that's how you can tell it is the DeBakey, because it's very smooth, very fine.
And then here's a smaller DeBakey
And
in
that's
comparison.
these are used in a lot of major abdominal cases.
Bowel case, bowel obstruction. Let's see. Here's your rat tooth. Big and small.
All right, so the rat tooth again, it's got that little teeth on it. Alrighty.
Oh.
And those are called Bonnies.
See the difference?
So the difference is Ferris Bueller has hips and Bonnie doesn't.
Straight
Bonnie's
crime.
slim. Okay.
Then we had some Adsons.
Those Adsons again with the hips. Alrighty.
And that's it.
Do we have smooth?
Yeah.
Oh, these are
I thought we did.
smooth tissue. So they had the railroad tracks on the hips, but they're smooth and they're not as. Can you show them like the difference between the DeBakey and the?
Oh yeah.
So the difference is.
Here we go.
So see how fine and how those are kind of more bulky. That's the difference. So Smooth is in her left hand, and the DeBakey is in her right. All right. And any knife handles that are different than what we've seen?
Nope, 3 long. Nope. You'll see the 4s in labor and delivery.
Okay. And then that is a pull section with guard. And again, that cannula, gotta be careful. Stuff gets stuck in those little holes up there. So that's our major lap. And we'll